Hi everybody, it's me again, Dr. Albert Malvehi at East Bay Vein Specialist, also known as Dr. Vein Eraser. And today we're going to talk about a question that we get very frequently: spider veins and varicose veins. What's the difference? We definitely get a lot of people who they call up, they know that they have a vein problem, they've heard those two terms and they're not sure which they have when we're asking them over the phone. And it's important because it makes a difference of how they're treated between if they're spider veins or if they're varicose veins. So the answer is varicose veins are coming from a deeper circulation problem. They're the big bulging veins that we see just under the surface of the skin. They have sort of a 3D appearance. Spider veins are veins that are actually within the skin surface itself. So your skin in the legs is about 2 millimeters thick, about so thick, and little tiny veins that are naturally occurring in there, when they get a little too tired, as they do with age, they get dilated or a little bit larger, and we can see the blood within them, and those are spider veins. We have some examples here, and these are why we have these two pictures up here. I don't know if you can get a little bit closer so you can see them. So over here are spider veins. You can see these are the blue and purple veins that are commonly on the surface of the skin, and they're thin. They're usually about 1 millimeter or less in terms of thickness or size. And 1 millimeter is really small, it's about that big. Varicose veins, on the other hand, tend to be these larger, bumpy veins that come from down deeper in the circulation. So it's important when people call the office, we try and get a sense, does this person have varicose veins that are coming from deeper down in the circulation, or is it just cosmetic spider veins that are within the surface of the skin? And the reason why that matters is because for people with varicose veins, which are coming from deeper down in the circulation, it's important that we understand where they're coming deep down, because you can imagine all of these people have slightly different anatomy, and then the fix for them is also going to be slightly different. So that's why we have this trusty machine over here called an ultrasound machine. So for people with varicose veins, we need to do an ultrasound of the legs and identify where the problem varicose veins are coming from, actually find the root of the problem. And that's for the varicose veins. I do the ultrasound myself when people come into the office, and during their procedure or during their ultrasound, I can show them this is exactly where your root problem is, and this is how we're going to fix it. For spider veins over here, they don't need an ultrasound. These are just within the surface of the skin, and we can essentially proceed directly to discussing what the optimal treatment is. And the overwhelming majority of them can be treated just with injection therapy. It's also called sclerotherapy. Sclerotherapy is just a fancy medical word. It means we're going to inject something to sclerose or collapse the vein. Even though we don't use salt water or saline anymore, that word is still sort of lived on. So if you've always wondered, now you know the difference between varicose veins and spider veins. Until next time, eraser heads. Bye.